Welcome to Dr.RS channel and another episode of Food is Medicine. I'm Sunya Arash and we are joined by Dr.Riffat Sadiq. Welcome Dr.Riffat Sadiq.
Thank you for having me.
Today we will be talking about burns. Before we start talking about it, let's watch a short clip about it.
In the case of a burn, cool the affected area with cool running water as soon as possible for a minimum of 10 minutes. This will reduce the pain, swelling, and risk of scarring. Do not use ice or ice water. Next, cover the wound in cling film or a plastic bag to reduce pain. Do not burst any blisters. If the burn is severe, immediately call the emergency services. If you find yourself in the right place at the right time, be prepared to save a life and follow these safe steps.
Welcome back everyone. I hope you found the clip helpful. So Dr. Riffat Sadiq, let's start with what are some common ways someone might experience a burn?
I think there are multiple ways. The most common is when people are cooking food, because that's where we are in hurry and we are picking the things out from the oven, and that's the way I get burns. But ironing clothes, that's another way people get burns. People also get burned from the hot water, the steam that we call scald. So that's another, and that's actually very, very painful burn. One time I got it and it was so painful. Another way people get burns are from the sun, they call it sunburns, and also from laser. Now they are some small machines, laser machines, and people are removing their hair or they are doing multiple stuff with those laser machines, and they get burns from those also. So, and another burn type of burn is chemical burns. There are some materials which are very, very dangerous one, and if we get exposed to those, we can get burns, and they are known as chemical burns.
So what we should expect when we got burned or scalded?
Sometimes it's nothing, small. You will see this little redness of the skin. Sometimes if the burns are like extensive burns, you will see peeling of the skin. There is some swelling. Sometimes the skin gets like charred. Sometimes you will see there can be different symptoms, and sometimes the people will have a lot of pain. It depends what kind of burns people are getting and from how they are getting these burns.
So now, what are some steps to treat these symptoms?
The things. The number one is at that time when you get this, exposed. You are taking something from the oven, or you are get exposed to some chemicals, or first step is to move yourself from that environment. That's number one, safety. Number two is see what if it's like really extensive and you are home alone and you think that it's like if you can get to 911 if it's really bad, or if the chemical burns, you need to call 999, because they are the special units which treat these chemical burns in a very special way. But if there are small burns, like which we get all the time at home, you can actually do, have a cold water. I usually put some vegetable bags I take from the freezer and put it on that. Another thing which I use all the time is toothpaste. And so I'll put it on the burn and it actually helped me. But sometimes, each burn, it depends on how much burn we get. But moisturizer, sometimes putting just a Vaseline or any cream, any moisturizer, that can help. So it depends on if the burns are like really larger and there is swelling and infection, then you need to obviously get treatment from the doctor, and they will give you antibiotic, they will give you specific medical treatment.
Are there different kinds of burn?
Yes, some of the burns are superficial burns. We call it, they are only touching our superficial skin surface, that is epidermis. We call it very superficial. And then if they are deeper, like dermal, and then even deeper than that. So skin has three layers, and if it's affecting all three layers, we call it full thickness burn, and that can be really, it takes time to heal, because we need the time to regenerate the skin. So superficial burns heals quickly, but if they are deep burns, they take time. Sometimes, people, my own niece, she was a kid, and it was a table, and my sister put a tea on the table in a kettle. So she was running around. So she actually somehow kettle got stuck. The nozzle of the kettle got stuck in her sweater, and she got burned. And it was a full thickness burn. She still have the scarring of that. She got a right treatment right there and then, but sometime people also need actually they need a really extensive treatment. They actually also have the skin grafting, because she didn't get the skin grafting at that time, but her scarring is still there and it's all hair. So skin burns can be very dangerous. We have multiple examples. My own aunt actually passed away with the burns because the stove, she was cooking the food, and somehow her clothes got fired from the from the from so she passed away. So it's please don't take it easy. um, Make sure your surroundings are safe. Make sure when you are cooking, you are not, you know you wear proper clothes. Don't wear too loose clothes, so they can catch fire quickly. So make sure that you are safe when you are around these stoves especially.
And which level burn we should seek medical treatment?
Always superficial is fine. I mean, we all get all the time. But if it's a deep, you need attention. It takes sometimes months to heal those. So you need medical attention for the deeper burns.
Do you have any tips for recovering burns?
First of all, which I tell everyone, that they have to be extra cautious. Whenever they are in the kitchen, make sure that, like especially when I'm cooking, my husband will come and he will say, make sure your scarf is not around the stove, because if I'm wearing scarf and I'm cooking, so it can catch fire easily. So we should wear proper clothes when we go and cook, uh, and make sure we are not having too many loose clothes, so that it can catch fire. That's my hazard. So I'm telling people that what I do for myself. Other than that is like, if you make sure that iron is off, make sure that you are cautious around hot things. When the people are doing laser, they have to be extra cautious. The strength of the laser, how they should be using numbing thing, how should, when they go out for sun, they should use proper sunscreen. There are some tips for all these kind of ones. We have to be just cautious. We have to think ahead before we start doing any big things.
Very well. Thank you so much for all information, Dr. Riffat.
Thank you for having me.
Thank you so much for watching. Don't forget to like our video and subscribe to Dr.RS channel.